Hello, my name is Morello Kane. I am with thehairdebate.com and Sweet Morality Salon, combining both brands into Morel, all things hair. I am here in Soka Centers with Dr. Nikki Hill. Hello, Dr. Nikki.
Hello. Good morning, and your hair is lovely.
Well, thank you so much. Well, thank you so much. I was feeling a little firecrackery, I tell you, and I am rocking Influences Artistic Semi-Permanent line. Yes, it is new. I tell you, it is infused with macadamia nut extract oil, which leaves a brilliant, long-lasting shine. And I tell you, Dr. Nikki, they have a class coming up July 23rd. Do stay tuned and visit our social media pages, because I am going to definitely post more information regarding the class. And so we are here. I have with me today my son. I have witnessed with a condition that he's been having for some time now. And I tell you, Zach, how long have you noticed this condition, which brings us here to Dr. Hill's office today?
For about a little over a year.
Okay. And when I tell you, when I saw this condition, me being a hair care, a licensed hair care professional, I said, Zach, let me take a look at that. And I realized that it was outside of my league and that he needed to indeed seek the advice of a professional, of a specialist. And so what I saw here was patches of hair that was missing. He initially had a patch here that did grow back, but then he developed other patches along the way. And so I said, you know, we definitely need to have that seen. And so I tell you, Dr. Hill, thank you so much for seeing us today. And as you see here, and let me just ask you this, Zach, what did you use on your hair? You know, like what, when you saw the patches, what was your thought?
I really didn't know what it was. I just used to get my hair cut down, you know, a little fade, so you wouldn't notice it or something like that.
Like most men do, like most men do. And when I actually realized that he was doing that, you know, and so I said, well, Zach, you know, you really need to see a doctor. So, you know, what did you do in trying to figure out what it was?
I just did research online to see what it could be, what it could possibly be.
Okay, researching online now, how many of us does that? Okay, you know, we go to Google, you know, and we try to be the specialist. And I tell you, we are here a year later with a couple of more spots, you know. And so I tell you, you truly need to seek the advice of a professional. So Dr. Hill, what would you say that this is?
Yes, so I'm so excited to be talking about this because this is a condition that happens equally in men and women. So alopecia is just a general umbrella term for all things hair loss, hair breakage, hair changes, whenever the hair is not acting normally. So this particular condition is called Alopecia Areata, and the way you can categorize it is that it kind of creates these coin-sized little patches of hair loss. So if you actually look close at these little areas, it's what I always say is baby bottom smooth skin. There's no stubble, there's no redness, there's no scaling, or there's no color changes of the skin. It just looks like perfectly healthy skin. It just doesn't have the hair follicles, doesn't have the hairs growing out of the follicles similar to the rest of the scalp. So there are different types of alopecia areata. This is the most common type where individuals can have little patches. Usually it's triggered from some internal or external trigger. So usually someone may have like a major life event, like an illness, a stressor, a surgery, pregnancy, starting or stopping medications. Things like that can easily trigger an alopecia areata, and it usually lasts occurs 1 to 3 months after that inciting event occurred. So a lot of times with the autoimmune, or alopecia areata is a type of autoimmune condition, and that just means the immune cells are revving up and they think that the hair follicles are foreign, so they're attacking them. And the scalp is very, very simple. It grows hair, it fights inflammation. It cannot do both at the same time. So that means if there's a little spot of inflammation and those little inflammatory cells are in that area, then the scalp's not going to be able to grow hair. Now the good thing is those follicles are viable, they're healthy. It's just that they're being distracted. So once if anyone goes through treatment, then we're able to remove those distractions, remove the inflammatory cells from the scalp in that area, and then the hair will regrow like it needs to. Now, there are different types of alopecia areata. We talked about the alopecia areata patch type. There's also where it can involve the whole scalp, which is totalis. It can involve eyebrow hair, eyelash hair, beard hair, and body hair, which is when we call it universalis. So it's very important to try to capture a good diagnosis and to start treatment early. The reason being, if alopecia areata is allowed to continue to progress, one, we don't know which individuals will just have a patches and spontaneously may regrow versus individuals who may progress to full body alopecia or full scalp alopecia areata. So it's really important to go to a board-certified dermatologist who specializes in hair loss disorders and has the tools necessary to perform a good physical exam so they can get an accurate diagnosis. I typically use an instrument called a dermatoscope, which is the practice of dermoscopy, which is a polarized microscope that can allow me to look very closely at the hairs on the scalp. So right now, just looking with the naked eye, it looks like there's no hairs there. However, if we were able to take the photo, and I can show you a little bit later, we'll have an insert in here that shows that there's little small individual hairs that are growing back into the area, and there are actually some hairs that are tapered, meaning they're thicker at the end of the hair, but as the closer you get to the root or the scalp, they start to become finer and finer. And that's also indicative showing that there's alopecia areata on board. So a lot of times it's important to seek just medical treatment and just a good medical diagnosis. Reason being, alopecia areata can be associated with other type of conditions like thyroid autoimmune conditions. Other things that we may look for is that there's vitiligo, or where pigment can be lost out of the skin. So those are all kind of autoimmune type of conditions where the immune cells may attack either thyroid cells, or it can attack skin color cells. So we just have to be very cognizant, making sure we're not missing anything. The other thing that we look for in our physical exam is just to look to see if there's any kind of pitting in the nails. And pitting is when it actually looks like someone took a little tiny chisel and made little divots in the nails. And that can be a good sign that alopecia areata has been going on for a good duration of time. Now, the question is always, if someone has alopecia areata and they undergo treatment, can they get it again? And the answer is we don't know for sure. They have a predisposition to develop alopecia areata again. Typically, the younger the person with their first onset of alopecia areata, the more cyclic or more ongoing that it may or kind of come and go in that type of pattern over time. So we just have to make sure that we're monitoring those individuals. They have really good kind of stress relieving activities to help make sure that their immune system doesn't rev up over things such as stressors, illnesses, and things like that we can't control, of course, but just making them aware if they do see a patch to actually get it treated earlier. It's easier to have those follicles respond if we catch them early as opposed to years and years later.
Well, I tell you, Dr. Hill, and let me just say this, because I would really like for our viewers to see that tool that you have. And while I am just, finding out from Zach on what was going on in his life at this time to contribute to this, then would you be able to get that too? Okay. And so let me just ask you, thank you, Dr. Hill. And so, Zach, let me ask you, what was going on in your life, say like a year and a half ago or whatnot? I mean, was it anything in particular that you could say that was going on?
I can't say, honestly. I was just working, and I honestly can't say anything that was going on that was really stressful or anything.
Well, you know what? Sometimes we don't think about it, but I know that you used to be up because he writes music, and I know that you used to be up a lot, at night and possibly not getting rest. Again, this could be internal. We don't understand that what the body goes through on the inside. And so that's also why it's so important. We do have things that go on the inside which show up on the outer surface, as you see here.
Mm-hmm. Absolutely. And sometimes it's difficult to even know what the trigger was. I've had patients where it was as little as they made a relocation, or they changed the shower head filter. It can be something that you wouldn't even think of, or it could be everyday stressors, but the body for some reason just responded in a way that it did. So it's always good to know if there's something that made a significant change, so we can try to change that trigger, remove it if it was like starting a medication during that time, talking to your other physicians that prescribed it, so if we can find alternatives or things like that. So it could be something significant, or it could be something that you wouldn't even be able to recall. So that
Right.
that can sometimes easily happen. We may not even know what the trigger was at that time.
Absolutely.
And then just to show you a little bit the dermoscopy or the dermatoscope. So this is the polarized microscope that we use, and it can illuminate, so it really helps us see a little bit past the first couple layers of the skin, and also looking at the follicles in a magnified view. So it gives us a lot of information. Dermatologists can use this to kind of help them diagnose skin cancers. It can help them see certain characteristics of rashes very up close, but it's also a really good tool for helping to diagnose any type of scalp conditions that can lead to hair loss concerns. And then when we take photos on certain adapters, it actually can give you a really good view. So we looked a little bit earlier at the two areas on the scalp, and with the naked eye it looked like there were no hairs there, but this actually shows you that there are hairs in that field. And interesting enough, there's something, what we were discussing, the exclamation point hairs, so where they're thicker at the end, but when you get closer to the root, they start to taper down. And that's what we see called exclamation point hairs, and those are in alopecia areata. So the diagnosis officially is alopecia areata, and then just discussing treatment options. They're wide and varied. There's no true standard, but a lot of times we can do topical steroid creams, which he can use at home on a nightly basis. We can do injected steroid treatments, which is usually once a month in series. And then there's also topical immune therapy treatments, which we literally paint on like a thin layer of liquid, and no symptoms, no concerns. You rinse it off in 4 hours, and it helps reverse or really distract the immune cells away from those areas. So it's really effective. A lot of times the earlier that we start initiation of treatment, the quicker and the better the response, just so that way nothing progresses more than it needs to.
So I tell you, and I'm so very thankful because we have 3 different alternatives that, that could be used to treat this condition. A lot of times when I speak to clients in my salon, and when I have them to go and seek the professional advice of a dermatologist, they always seem to come back with the same solution of, oh, it's just a steroid shot, I just need the shot. And I'm just like, well, no, that's not always the solution. So I tell you, Dr. Nikki Hill, from collaborating with her and us talking, she has shed light to so many different things in reference to how the different ways of treating different conditions. So she is definitely a woman that knows her thing. And I tell you, she's an expert in her industry. So I thank you so much, Dr. Hill, for having us here today. We will come back with Dr. Hill, and I tell you, there are other clients that are going through so many different things and conditions and whatnot that are going to come back and